Thank you for joining us today for the updated College Alcohol Intervention Matrix, CollegeAIM, What Colleges and Communities Need to Know Now webinar. This webinar is a partnership between the National Institute on Alcohol Abuse and Alcoholism, or NIAAA, and the International Town and County Association, ITGA. The ITGA is a membership-based organization that provides resources and professional development opportunities to address the challenges, emerging issues, and opportunities between institutions of higher education and their host communities. My name is Beth Bagwell, and I'm the Executive Director of ITGA, and we welcome you to this webinar. Now I'm going to introduce you to Fred Donadio, Communications Director of NIAAA.
Thank you, Beth. And on behalf of NIAAA, thank you all for joining us for today's webinar. As some of you may remember, NIAAA has maintained a robust college drinking research portfolio for many decades. In 2002, our College Drinking Task Force, which was comprised of college presidents and researchers, released a comprehensive report, which is still available today, by the way, on our website. And it was called A Call to Action, Changing the Culture of Drinking at U.S. Colleges. This report included a very simple chart that grouped common alcohol interventions into different categories of effectiveness based on peer-reviewed literature. Looking back, this was, in fact, the precursor of CollegeAIM. In subsequent years, we created a college president's working group whose members asked to create a more robust product, excuse me, one that would analyze costs associated with interventions along with the levels of effectiveness. At that point, when we got that request, we knew we were onto something, and we reached out to 6 of the most respected and distinguished researchers in the field, 2 of whom are with us today, to serve as developers of this new product. They divided into 2 teams, one that focused on individual-oriented interventions and another to cover environmental-oriented interventions. We also asked an additional 10 experts to serve as reviewers of the early drafts. So CollegeAIM, again, the College Alcohol Intervention Matrix, was released in late 2015 after a multi-year development effort. It was and remains an easy-to-use and comprehensive tool to help schools address harmful and underage student drinking by directing them to effective, evidence-based intervention strategies. And as requested by the presidents in our working group that I mentioned, it evaluated common interventions according to a number of factors, levels of effectiveness, costs, and other considerations. The original CollegeAIM was distinctive because of the breadth of its research and analysis, the expertise of our contributors, and its user-friendly format, which included an extensive review of decades of scientific literature, ratings for nearly 60 interventions, and the inclusion of 2 user-friendly matrices, along with other resources. A final point, and it's the reason really why we're here today. As valuable as CollegeAIM was, we knew that to remain relevant, it needed to be updated periodically to ensure that it always captures the most recent research and that it features the most current ratings and analysis. So 2 years ago, we embarked on an ambitious update project, and we're very fortunate to line up the same 6 original developers to oversee this very important revision. And the results are impressive, as we might have expected. This revised CollegeAIM now draws from peer-reviewed literature through 2017. It adds 7 new interventions to the original 60, and it features updated ratings for 5 of the existing interventions. With this important update, CollegeAIM remains as relevant and useful as ever, and we're excited to review it in today's webinar. I'll now turn it over to Dr. Jason Kilmer from the University of Washington, who is one of our original and notable 6 developers. But first, I'd like to extend my deepest gratitude to ITGA and all of today's speakers. The fact is, CollegeAIM is, we think, a very valuable product, but it is only useful if college administrators know about it and are comfortable using it. Today's discussion and others like it will really help spread the word. So thanks again for joining us, and please share what we discussed today with your colleagues. That helps spread the word as well. Thank you so much, and I'll turn it over to Dr. Kilmer now. Thanks.
Fred, thank you very much. My name is Jason Kilmer, and I'm an associate professor in psychiatry and behavioral sciences at the University of Washington. I always say that feels like a lie, because at this point, I have not been at the University of Washington since March 6th, 2020. So welcome to the University of our dining room. But what a treat to get to do this today. I'm actually going to be running the slides from my laptop, but tagging in and out with Jessica and Alicia. Before I dive in, I would like to have them unmute and briefly introduce themselves as well. So with that, Jessica, if you could say hi to everybody.
Thanks, Jason. I'm Jessica Cronce. I'm an associate professor in the Department of Counseling, Psychology, and Human Services at the University of Oregon. I'm very happy to be here today. And as Fred mentioned, was also part of the original team developing CollegeAIM.
And Alicia.
All right. Well, good morning or afternoon, or maybe evening, depending on where you are. My name is Alicia Baker. I'm the Assistant Director at GatorWell Health Promotion Services at the University of Florida. I've been in my role for quite a while now. I've been in health promotion for 6-7 years, and I also currently serve as the co-chair for NASPA's Alcohol and Other Drug Knowledge Community for those that are involved in that organization. So happy to be here.
Well, I just want to say what an amazing turnout. Thank you all for your interest in this topic. I'm going to dive right into this. You know, Fred acknowledged, and I want to acknowledge as well, Beth Bagwell, all the work she's done along with Susan Stafford. We can't do what we do on college campuses without partnerships with the community, nor vice versa. And so the involvement of ITGA is huge with this. Fred Donadeo has been a friend to and champion for how we put science in the hands of folks on college campuses. I met him at the University of Puget Sound in 2002 when they were rolling out the first NIAAA Call to Action Task Force report. And in the years that have passed, he's continued to do all he can to make sure that what we do on college campuses really is informed by the science. Deb as well, his partner at NIAAA, and NIAAA for the work they do to support college student drinking prevention, intervention, and all we do to help students. And also thanks to all of you for making time to do this today. What was the hope of CollegeAIM? Independent of, you know, visible efforts or what people were saying, like, do this, the goal was, what can we do to increase the likelihood that science informs interventions and what we do on college campuses by providing a framework for schools to compare and select evidence-based intervention strategies. I often say I'm convinced I was the 6th least valuable member of all these 6 people, but we had 2 teams of people, as Fred mentioned. A group led by Mary Larimer at the University of Washington that reviewed the scientific literature on individual strategies, and then a group led by Tracy Toomey at the University of Minnesota that led the group on environmental strategies. When we did the original CollegeAIM initial development, these were the teams. When we started doing work and it was clear we were going to do an update, some of our affiliations changed. Jessica went to the University of Oregon, and when it was clear as well kind of the role she was playing, then became the lead of the individual strategies team. I realized when I put in each of our school logos that this was, the slide was talking to me. Like initially I was like, wow, look at all these people. And then when my friend Jessica left, I was like, oh, and that's what's on that slide as well. But what did we do? Phase 1 was identifying interventions to be included in CollegeAIM, figure out what dimensions we were going to evaluate them on, and come up with a coding system. Phase 2, go dive into the literature, identify, review, and rate the scientific literature. In the first one, we rated almost 60 interventions. By the update, it was over 60 interventions. Jessica is going to talk more about what went into some of the actual ratings and decisions. There's a lot on this slide, and it's meant really to allow you to see the decisions and dimensions over which we rated. relative effectiveness, amount and quality of research, relative costs, relative barriers, staff expertise. Is it a federal, state, local, college strategy level, public health reach, the target population, the research population, and then on our side, the individual level, short versus long-term effects, and the primary modality. Then we did this iterative review process that I'm confident is the single most impressive peer review process anyone's been a part of. We had all the recommendations come from our team, sent it out, 10 reviewers that were unknown to us reviewed the ratings, applied their knowledge and judgment, sent back comments, we responded, sent back, they provided comments, and we tagged back and forth until all 16 people said, we got this. We agree with where things are. We agree with the decision. So through multiple rounds of review and revision, the process took decades of science, hundreds of studies, and put it into a user-friendly decision tool. This is meant to make you go, whoa. And if I could hear you, I'd believe you're all going, whoa. Because this shows you how many approaches we actually did review. On the environmental side, it was campus only, community-based only, or campus or community with the overlap. On the individual side, it was education or awareness programs, cognitive behavioral skills programs, motivational or feedback-based, and then interventions delivered by healthcare professionals. So whether you are in a community, a coalition, or on a college campus, the idea was, how can you review individual and environmental strategies to compare approaches? And then take a look at what you have. Is there something we should be replacing that's less effective? Is there a gap we have? And the hope was you did not need to have a science background, nor even necessarily an alcohol and other drug background to use the interactive strategy planning worksheet and select a combination of approaches based on needs and on budget. The idea was anybody trying to utilize CollegeAIM could assess behavior on campus and set priorities. You know your own campus best. What do your data tell you about what drinking and drinking-related consequences on your campus look like? When you take stock of policies, what do you have? Are they being consistently enforced? Really get a sense of what's in place. Then select strategies after exploring the science-based interventions in CollegeAIM, plan out how to carry out the strategies and measure results, and implement the chosen strategies, evaluate them, and refine as you go. So to start, the idea is compile what's already offered. If you go to CollegeAIM in the website, you'll see where it says worksheet. First, look at that amazing special effect right there. If you click where it says worksheet, it brings you to this worksheet. You never want to say like, this is the best part, because there's so many best parts, but this is an invaluable tool. The idea was this should not be filled out by a single person. Get a group of people together. Can you all agree on what you're offering? Are there things being offered on campus you did not even realize folks were doing? Figure out by putting in at the top the current strategies. Are they individual or environmental? Are they even in CollegeAIM as effective? If they're in CollegeAIM, what's the effectiveness rating? What's the relative cost, barriers, the reach? That right side's really important. What do we think? Like, do we have this program, but no one's really getting to it? Do we have a policy, but it's kind of wink, wink, no one really enforces it? What do we need to do to enhance it? And then look at possible new strategies by seeing what's in the matrix. So when you turn to CollegeAIM, you can click on the website, individual strategies or environmental strategies. Realize you can also download a PDF and you can order a paper copy, which is slick. It's good to have that hard copy as well. In the hard copy, you will see the individual level strategies and the environmental strategies. You will see that they're rated or organized in columns of relative cost and then in rows of relative effectiveness, with higher effectiveness, moderate, lower, not effective, and approaches that were too few studies to rate the effectiveness of. If you go to the website version, and I tried to actually do screenshots so you could see how this works, you can select a strategy to see ratings, references, and potential resources. So if I clicked on environment and I went to higher effectiveness and I wanted to look at age 21 enforcement, you click on that blue hyperlink and it will bring you to this pop-up that allows you to see the overall ratings, the summary. You can click on notes, you can click on references, you can click on resources. But if you click on references, it will literally bring you to a scrollable list of all the references, and anything that is hyperlinked, you can actually click on and it will bring you to the article. Where was that when I was in grad school for doing lit reviews? Fun fact, you should still do lit reviews. But it's great to be able to bring the science into your hands really, really quickly. If you want to compare things, especially, even print out, you can click on multiple strategies. In the upper right, you'll see where it says print. When you click print, it literally will give you everything you could possibly click on, all in one, either PDF or something you could literally print to paper. And then if someone says, what's the hidden treasure in CollegeAIM? I think it's the FAQ sheet. If you click on the FAQs, you'll see that they are organized into 4 categories: frequently asked questions about monitoring campus alcohol issues, about selecting and implementing strategies, about responding to potential objections or challenges, and about CollegeAIM itself and ongoing research. Bottom line is, if a question came up, the team did all it could to draft answers that anybody could use as they're going through this process. On page 5 of the actual document you can download or order, it says, consider a mix of strategies. That's so key. If a campus says, we're doing this, our first reaction is, awesome, what else are you doing? Quoting verbatim, your best chance for creating a safer campus could come from a combination of individual and environmental level interventions that work together to maximize positive effects. I think what's so special and unique about this joint partnership today with ITGA present is that if you look on page 6, it literally says some of the most effective strategies are carried out in the communities and states surrounding the campuses, such as enforcing the minimum legal drinking age. Campus leaders can be influential in bringing about off-campus environmental change that protects students. Yet, to achieve success off-campus, partner with leaders and coalitions in your community and state. Building these partnerships take time, and in the FAQs, they give guidelines for how to do that. So know from the bottom of my heart, we can't do what we do on campus without those community partnerships. When you look at the TG and ITGA, having those town gown associations matter in such a big way. And so when people have said, you've rolled out CollegeAIM in 2015, you did the update in 2019, what are you hearing? What we've heard, having presented at numerous conferences, people love the direct access to articles, particularly if they don't typically have access to articles in PubMed, PsycInfo, or other outlets like that. People have said that worksheet is a game changer. It is a reason to bring partners together and stakeholders together that might normally not be talking to one another about these issues. People say it's also really, really eye-opening. Like, wow, I had no idea police was offering this prevention program that may not be that effective. They didn't know we were offering this, and so on. The FAQ page, people have said, has been instrumental in literally providing cue cards for how to respond when certain questions come up. There are strengths to both the HTML web-based version because it is alive, it is vibrant, which you can't say about a lot of websites. But the PDF is so valuable to have as a document. Again, absolutely download or order a hard copy from NIAAA yourself. The fact that it's organized by relative cost is really helpful in prioritizing in a tough budget climate. If people are saying, we're doing this one approach that's not that effective, but pretty expensive, can you pick something more effective that has less of an impact to your budget? Or if you're trying to decide between 2 approaches, if your budget can pull off both, great. If it can't, and they're equally effective, can you perhaps prioritize the one that's less expensive? And what we've also heard, we've had people say, CollegeAIM is great. Where's the cannabis CollegeAIM? Or where's the CollegeAIM for relationship violence and sexual assault prevention? People wish there were tools like this. And I've got to believe that as the research in those different prevention domains grow, the hope is you'll see something like that one day. But for now, it's been great to see how this has been received. And with that, I'm going to tag over to Jessica, who's going to talk about what is new and what's changed, as well as what we're looking forward to with this update. Jessica.
Thanks, Jason. So I'm going to start by expanding a little bit, as Jason foreshadowed, on the ratings that were used in CollegeAIM. So I don't have all of the dimensions represented here that Jason listed for you earlier, but these are some of the main ones that are featured, especially in the PDF version. And these were ones, effectiveness and relative cost, of course, which are the main dimensions of CollegeAIM, and then other ratings or other dimensions where there are two teams differed, right, between environmental and individual focused. You can see there are some subtle differences in how we approach this based on the structure of the different prevention programs. So one really important thing I want to call out on this slide is that both teams felt that there was a threshold where there was just too few studies to rate. And so, to the extent that this continues to be updated over time, which, I sincerely hope is the case and have every reason to believe will be the case, we hope that there are more studies that come out so we can move those up. And you'll see how that has actually happened from 2015 to 2019. For us on the individual side, that threshold was 3 studies. So there needed to be at least 3 or more studies for us to be able to rate that on effectiveness. In terms of relative costs, I will say that for many of the different prevention programs, there's not actually published costs. And so that's where really that extensive peer review came in. All 16 professionals weighing in on where they felt based on their knowledge on their campuses, their knowledge of other campuses in the field, of what the relative costs would be all in terms of personnel, equipment, everything that might be needed for implementation. So it is relative to one another, lower, moderate, or higher. Next slide, Jason, thanks. So in terms of what's new, I'm going to start first with the environmental focus strategies. And I want to own, again, this was not my side. I was on the individual focus team, so I know less about the details of these strategies. But there were 3 new ones included in the 2019 update. They're all in the mid-range cost. You can see them highlighted there on the PDF version of the environmental matrix. But they were differed in terms of their level of effectiveness. So there was one new strategy added that was in the higher effectiveness category, which is to establish minimum unit pricing. In the moderate effectiveness category, there were 2 new strategies added. The first being to conduct reward and reminder or mystery shopping visits. And then the second to be enacting false or fake ID laws if those laws are not already placed in your jurisdiction. In terms of strategies that changed based on new studies that came out between when the matrix was published in 2015 and 2019, one of the strategies in the environmental matrix actually moved to a higher level of effectiveness based on new research, and that was restricting alcohol sponsorship and advertising. So that actually was initially ranked as lower effectiveness and then moved up to moderate effectiveness. And then one other strategy actually moved to a lower level of effectiveness. So as more research came out, that got bumped down, and that was retaining a ban on Sunday sales. So that's listed now as moderate of effectiveness. On the individual focused strategy side, there were 4 new strategies that were included in the 2019 version of the matrix. The first of those being decisional balance exercises alone, and that's in lower cost and moderate effectiveness range. And decisional balance is weighing the pros and cons of changing a behavior or not changing a behavior. The next strategy was protective behavioral strategies alone, and those are strategies that students can use before drinking or while drinking to minimize the risks of harm from alcohol use. The last 2 that were added are actually commercial or branded programs, which is why they're italicized. The first of those is Alcohol Wise, and Alcohol Wise, I will say, actually subsumes another commercial program that was ranked in CollegeAIM, which is eCheckup to Go. So Alcohol Wise has eCheckup to Go as a component, and eCheckup to Go is a personalized feedback intervention. But it surrounds it with additional alcohol education, and that was in the mid-range cost, moderate effectiveness. And then the last one is the drinking assessment and feedback tool for college students, or the Draft CS. And for this, there was actually too few studies for us to rate at the time of the 2019 matrix. So hopefully by the next update, there will be more studies of that approach. For us, we had one strategy on the individual focus side that moved to a higher level of effectiveness, and that was in-person norms clarification alone, and that moved from lower to moderate effectiveness. In-person norms clarification alone is typically a group-based intervention where students clarify norms related to alcohol use in the way that they might with an individual style intervention I'll talk about in just a little bit. And then we had two strategies that previously had too few studies to rate that actually now had enough studies for us to feel confident in commenting on their effectiveness. The first of those was a commercial program, Alcohol 101 Plus, and that actually, based on the available studies, was in the lower effectiveness category. And then the second approach was blood alcohol concentration feedback alone. And what that typically looks like is a resident assistant or perhaps a staff person going to a fraternity or sorority party or other off-campus party site, doing breathalyzer tests at the door, typically of the party or of the dorm, when people are leaving, and giving that feedback. And that was actually found to be not effective, and in fact was associated with, at least at times, students increasing their drinking, potentially turning that into a game. So that one was not effective. So given our present moment, I also just wanted to briefly comment on what are the options for efficacious prevention that doesn't involve in-person face-to-face interaction. I know states are still highly variable in terms of how much staff are able to meet with people in person or in the community, how much you're able to deliver in-person services. So some of the different strategies that are in the higher effectiveness, so I'm only going to talk about higher effectiveness strategies here, that are in the lower cost band are self-monitoring or assessment alone. So simply tracking how much you're drinking has been shown to be associated with decreases in drinking. Goal or intention setting interventions alone have been found effective. Those are highly variable in how they look, which is why I have a question mark here, as opposed to a sample. But really the core feature is setting a future goal or an intention related to their drinking, and then measuring how much their behavior aligns with that goal or intention. And then personalized feedback interventions, of which I mentioned eCheckup to Go is one, and that is a commercial program that's named in CollegeAIM. But what I have pictured for you here is not eCheckup to Go. I want to make that very clear. This is another personalized feedback intervention that was actually used in a study I was a part of at the University of Washington, Motivating Campus Change, which was funded by NIAAA. And personalized feedback interventions include information about students' alcohol use, their consequences experience, their beliefs about alcohol use, protective behavioral strategies, and normative perception. So how much they think other students drink relative to how much they actually drink. And that single component can be pulled out and has a whole separate research base, and that's referred to as personalized normative feedback, when you just give that chunk, juxtaposing students' beliefs of the norm with the actual norm. In the mid-range cost strategies, there are two in that higher effectiveness band. One is the alcohol skills training program. That's a group-based intervention that has been delivered in sessions all the way from 8 down to 1. And so there's a range of options out there. And really that is where the basics program, the brief alcohol screening and intervention for college students, got generated from originally. And basics is sort of the prototype for brief motivational interventions, which is the other category in CollegeAIM. Brief motivational interventions take that feedback, which is used in the personalized feedback interventions, and deliver it in person using a motivational interviewing style. And both of those can be delivered over computer using a program such as the one we're using today, Zoom. We actually have some concrete evidence of the efficacy of that for basics and brief motivational interventions through some work we did with Christine Lee at the University of Washington, delivering brief motivational intervention to community college students. And then the last strategy is in the higher cost category, and that's alcohol EDU for first year students. And this may be a program that your campus is already using, and it's really targeted specifically to first year students as a universal, or I guess more properly, a selective strategy, since you're only targeting that one group, and incorporates education as well as feedback and a lot of different components. And with that, I'll turn it back to, actually, I'll turn it to Alicia.
All right, thank you, Jessica. So I'm coming in more from the practitioner side of this. So consider this the fangirl moment of CollegeAIM, and talking about my use as a practitioner at the University of Florida. So Jason, if you could go to the next slide, I will just start by saying CollegeAIM is prevention. So talking about justifying the strategies that are used here, this is really coming from a prevention side of the house. For those of you that are familiar from the public health perspective around primary, secondary, and tertiary prevention, CollegeAIM is very primary and secondary prevention focused. If you prescribe to the Institutes of Medicine protractor, there are interventions looking at the entire population, so universal. There are selective, so those targeted populations, even indicated, so individuals that are increased vulnerability and risk. Going further past that, some of the common models and frameworks that we use in prevention, next slide, please. We use in our field in college health and health promotion, I'm sure many of us are familiar with the socio-ecological model. For those of us that are more substance use prevention focused, I'm sure many of you are familiar with SAMHSA's strategic prevention framework. If not, I highly recommend looking through those resources. It's a great framework for strategic planning and just figuring out program implementation from a substance use prevention perspective. Looking at how CollegeAIM fits into the socio-ecological model, I think many of us are very familiar with the notion that, yes, we do individual work, we're working at that individual level. And then Jason, if you could go to the next slide. We tend to focus a lot on individual student services, so basics, individual educational moments, all the way up to that interpersonal. But using CollegeAIM, and as it has been reiterated a couple times already, mixing the individual and the environmental strategies, this also provides that justification to administrators, to campus partners, to colleagues, that not only should we be doing those pieces individually with students and our other campus folks in the community, but this also gives us the ability to justify time spent on advocating for policy changes and doing environmental approaches. Even going to the next slide was the strategic prevention framework. If you are using SPF, you probably already are using CollegeAIM, or if not, this would make that process a little easier to do. After you look at your data, you do the assessment, you understand the capacity, whether that's staffing or funding. From there, you can look at those pieces, refer to CollegeAIM and decide, okay, based on my data, based on my populations, and based on my resources, what can I implement? Or maybe you're already implementing things that are very well reviewed and highly effective. And this just continues to justify maintaining those programs. And then when using these types of interventions, some of them already have evaluations tied into them, or it makes the evaluation process a lot easier to do, which can encourage sustainability. And if we go to the next slide, for some of you that are in the higher education realm, you are probably very familiar with the Drug-Free Schools and Communities Act, and particularly the biennial review. Many of us just finished up our biennial review process several months ago. For those that are not familiar with the Drug-Free Schools and Communities Act, for those that maybe are not familiar with Department of Education policies and federal law, if we go to the next slide, Edgar Part 86, within the Department of Education, there is a requirement, it's part of our Part 86 regulations, that institutions of higher ed must adopt and implement drug prevention programs, not treatment programs, prevention programs. So looking at this from, not only are we doing these things because obviously it's important from a public health perspective, but we also have federal regulations and compliance to deal with. For those that are familiar with the biennial review, or maybe not so much, there's been more and more importance put on compliance with Drug-Free Schools and Communities Act. And if you go to the next slide, So for the biennial review, for those that aren't familiar, this is a report that has to be done every 2 years, 2 fiscal years typically. That's an overview of your university's alcohol, tobacco, and other drug prevention programs, their policies, but more so in these recent years, also proving effectiveness. This is no longer a report where you're just checking boxes and saying, yes, I have a prevention program. This is also looking at, is this effective programming? Is this equitable? Like, for example, for student conduct sanctions, are sanctions being equitably applied to similar cases, or are we seeing subpopulations that are getting different conduct sanctions? And also, there's also this importance about having data to back up impact effectiveness. For those that may not be aware, in these recent years, Office of Civil Rights, whenever there is a Title IX investigation, more often than not, they also request biennial review reports. So this will also potentially come up in those cases as well. And a consequence, this is worst case scenario, but this requirement is also tied to Title IV funding, which for those that are not familiar, that is funding that is specifically designated for student federal funds and student federal financial aid. So this can impact financial aid at worst case scenario. And as Jason has mentioned in his part earlier, the best practice for this, as well as the CollegeAIM process, this needs to be done in a group setting. So whether you have a standing committee, a standing work group that fills this out every 2 years. So this complements really nicely and helps make the process a little smoother. Next slide, please. So just as I mentioned, so some tips for a practitioner or a health promotion office that wants to use CollegeAIM: fill this out as a team. I know there are probably some of you saying, but I am an office of one. I am one practitioner. I am one person in one office. But if you think about the role of environmental and individual interventions, you're not the only person doing this work, if you think about it. You know, are you the campus police enforcing these fake ID laws? Are you making sure that the 21 and up laws are being enforced? Are you playing a role in student conduct sanctions? You need to have these folks at the table too. For those of you, I see you're more community organizations and nonprofits. So if you're working with college students, are you in touch with your local university's health promotion office or student health center and talking through, hey, how are you doing this from the campus perspective? How can I help you? Another cheat sheet, of course, is using your biennial review. So as you're starting this process, because I know some people are revamping, looking at the strategies that are being written in your biennial review, sizing them up on the CollegeAIM strategy planning worksheet, and then in future biennial reviews, using that to help write your biennial review. So it makes it a little easier. Again, cannot emphasize this enough. Individual and environmental strategies, best approach. It's really the best practice to do this. And then I will also sing the praises of the website. It is very interactive. It is wonderful. I also appreciate citations because there is a plethora of alcohol research out there. So it helps really narrow down some of the best go-to citations for that, and that FAQ section. And then finally, just to give some examples of how to use CollegeAIM. So some of these I draw from my experience, but also some colleagues of mine. So for example, at the University of Florida, I used CollegeAIM to justify creating a basics program for our students. Previously, it was more psychoeducational in nature, and I really use this to justify freeing up some practitioner time from our counseling center, but also looking at this from a prevention perspective. For some of you that are working in college towns with football programs, there are a lot of athletic conferences that are considering allowing sales in sporting venues or already have. So using this to help guide and kind of give some suggestions around how to navigate that. And that's a very interesting conversation for anybody that wants to talk more about it. There's also it helps justify maintaining and allocating resources to enforcement of alcohol policies. For those in law enforcement, they are tugged in many different directions, and sometimes going and making sure ID checks are happening, that sometimes isn't a priority. So making sure that there's some sort of enforcement that's still being done and the resources are given to do that. And then again, building partnerships between higher education institutions and community coalitions, community nonprofits to support effective environmental changes. I know for us before COVID, we had a pretty great mystery shopper compliance check program in my community, but that's been put on pause because of the pandemic. So using this to really justify getting that back up and running again. But aside from that, the other thing I would also suggest, talk to your colleagues, talk to folks that are using this, get ideas, get suggestions, and my contact information will be here as well. And I'm happy to take any questions that people want to pose my way. But with that, thank you all so much. And I will turn this back over to Jason for final thoughts.
Alicia, thank you. I just wanted to share our contact info before I tag over back to Beth. I know that there's been some questions posed. We wanted to leave time to take those questions. Each of our email addresses are here. If there's information we referenced, studies we mentioned, anything you need to contact us for, absolutely please do that. I was struck that both Alicia and Jess mentioned mystery shopping visit. Honestly, that sounds like the most fun thing I could do after 13 months at home. So may you all have a mystery shopping visit in your future someday. So with that, I will stop sharing my screen, mute myself, tag over to Beth for her thoughts representing ITGA, and then we'll take time for questions. Beth, thank you.
Oh my goodness. We have worked with Jason in different capacities, and I am just so honored to be able to have this conversation with him today. I feel like we have been in your living room, which you refer to as the university. So thank you. And Jessica and Alicia, I cannot tell you how much we appreciate your time in bringing the very practical approaches to how you use this CollegeAIM tool. And I wanted to also thank Fred Donato for being with us today. He had some issues with his computer. So unfortunately, he didn't get to join Jason's living room, but he's still here. And then I'm looking at the questions that people had.
If this was a horror movie, Fred would be in the house right now. That's the thing. The call's coming from within the house. That's the important.
So what I thought we would do is just take a minute to answer the questions we have in the Q&A, because we're right on time. We have about 15 minutes left. Before we start with the questions, in case we run out of time, I'm going to be sending out a survey of today's webinar so that we can learn what you would like to see covered in future webinars. So if you want to, one of our questions that we've seen over and over again is there going to be a recording? Yes, we're being recorded right now. Will we have the PowerPoint? Yes, we have that, and I will send it out and make that available to each of you when I send out the survey. Also, I believe the first question we have is, do you know if any UK universities use CollegeAIM?
I personally don't know the answer to that, but certainly while this was developed and released here, I can't imagine that it wouldn't be applicable for both the planning purposes and review of science purposes. But Jess or Alicia, any news about use in the UK?
We would love for somebody to do it.
Yeah.
Absolutely. So, and have you considered reviewing tertiary prevention programs that support the prevention of relapse? Also, does Part 86 regs include tertiary in the legislation?
I'll defer to Alicia on the question about drug-free schools and campus components. I will say that when we looked at approaches, and Jess, if there's something you would add, please let me know. You'll notice that in CollegeAIM, there is a little gray box on the individually focused part that are approaches provided typically by healthcare providers. Screening, brief intervention, and referral to treatment, ESPER, is in that. And of course, depending on where someone's referred, relapse prevention would be a big component. Jessica and I both had the honor and privilege of working with Dr. Alan Marlatt, who is so involved in relapse prevention and even in basics. He acknowledged there was a bit of a relapse prevention component there. If someone says, this is how I used to drink, and I'm trying to maintain gains that I've made by drinking in a less dangerous or less risky way, what can I do to prevent a return to that previous behavior, prevent a slip, a lapse, and so on. But relapse prevention is very much in that, that realm. Jess, what might you add before I tag over to Alicia?
Yeah, I will say that we didn't purposefully exclude those studies. So for example, if we were looking at a universal strategy and the authors reported on that as an outcome, that was certainly included. But I will say that the primary focus within most of the studies in the literature is really on preventing or slowing initiation to drink, or addressing high-risk drinking versus, say, alcohol use disorder, or more that severe end, which it really is in that treatment realm. But to the extent that that was present in the studies on universal prevention strategies, we did include them.
Okay, thank you. And then another question is how to get communities to understand the benefits of the CollegeAIM, implementing it in their college communities. So that off-campus life we often talk about.
I personally think it's things like this. I think that, you know, as much as I geek out about science, science is worth geeking out about, and it's worth, you know, letting people know that tools like this exist. I don't think you can be a champion for academic success, student outcomes, or mental health without also being a champion for alcohol prevention. And so I think really doing all we can to make sure that people understand what's out there and how much of this does require partnerships both on and off campus. That's my 2 cents. I'll defer to the others if there's something they'd like to add.
Yeah, well, so I'll tag back to that question about tertiary programs in Part 86. So the nice thing, and maybe the frustrating thing about the biennial schools, the Drug-Free Schools and Campuses Act regulation, is that it's very 30,000 foot vague phrasing. The concept of like a prevention program, they kind of leave it at that. So you could consider, I know for our biennial review, we do include our collegiate recovery programs as part of our prevention program. So I think that gives you a lot of leeway in that perspective. But going back to the question about community colleges, I can kind of speak from more the administrative side of the house on this one. One thing to consider with community colleges, it's what we call the color of money. So, you know, where is this funding coming from? What is being funded at your community college? So do they have the funding for prevention services and prevention folks on campus? So that in and of itself, there could be, you know, population level surveys to justify the creation of that type of program and using student funding for that. I would also say I work at the University of Florida, and we also have a very strong community college program at Gainesville, Santa Fe College. And it is a feeder program for a lot of our UF students. We have a lot of students that start at Santa Fe to kind of get their feet wet and then transfer to UF. So in a way, you also have these students commingling in your community if you're in a very similar setup. So you might have a larger university that tends to intermingle with the community college students. So it's still a concern from that place too, because they're still in that same community. They're going to the same bars, they're going to the same house parties. So I know for us, we try to keep a really great working relationship with our community college because of that. So I definitely see that as talking points that I'd be happy to answer questions later if anybody wants to talk further.
Okay, so that question was actually regarding college communities, but I think the same answer would go to community colleges. So it's really sharing that information and getting that information out. Jessica and Jason, how do you all feel the research has evolved on bystander intervention between editions? That's a good question.
Yeah, I believe that's rated on the environmental strategy side. And thank you for shaking your head, Jason, to confirm that for me. And I would have to go back and look at the CollegeAIM, because again, that was Tracy Toomey, Kathleen Link, and Tobin Nelson's team that really did the work on that. I'm not certain. I know it did not change from the 2015 to the 2019, like it didn't change category. So wherever it was rated is still kind of where it stands. And so I think that, again, this speaks to if there are things that your campus is doing and you can evaluate it, like if you feel like it's working really well and that is sort of the linchpin of your prevention, and you want to see more on that. So if you're able to evaluate that and get that information out there, that's great. I know that there's a lot of different campuses that are using these approaches, and it doesn't always make it into the literature for us to be able to then include in tools like this.
I know, having heard the environmental team present on that in the past, the one thing they've said is it's a classic example of an approach that if it's working well, it's hard to interpret the data because your data might look like it's moving in the wrong direction. I knew of one school that made a huge focus on recognizing signs of an alcohol poisoning and knowing what to do as a bystander. And of course, their transports increased tenfold. The local paper said binge drinking increases 10 times at this school. It's like that, no, that's not true. But it does make it hard to interpret the data. And I know that that's where, and someone put into the chat that particular approach is rated as an approach with too few studies to interpret. It is that mixed findings that makes it challenging, is my understanding.
Panelists, we have another question, and I think this is what, for me, this is a lot of people want to know this. I think it's been asked in many different situations about how the incidences during the pandemic. What do you speculate are some of the contributing factors if there's an increase in alcohol-related incidents, and how can campus community members address them? That's the whole webinar. I get it, but.
I know that at the University of Washington, Scott Groppensberger has published recently, as well as work that Dr. Christine Lee has done, showing that there are a handful of students for whom use has gone up. There are some for whom use has stayed the same, and there are some for whom use has gone down. When we hear everyone's using more during the pandemic, that is a extraordinary normative misperception. And we have to be careful that, we don't even say things like that. Hey, I know everyone's drinking more now. That's a normative misperception. For those whose use has gone up, that does mean we need to be sure of how to address and or support any needs that they may have when they come back to campus. But it highlights, it's like now is the time to be planning, right? If we got an email yesterday about what fall is going to look like at my school, if people are saying, what do we want to have in place to support students based on what may or may not have happened over this past 13 months, now is the time to be having those conversations.
Yeah, and I'll follow up too. So we have colleagues at the University of Missouri, the Missouri Partners in Prevention team. They actually did a study. They do this health behavior survey that they conduct pretty regularly, but they were able to do it that they asked questions before the pandemic, during the pandemic, and the fall semester after everything kind of started. And very similar to what Jason said, there were certain populations that use went up, but I guess not surprisingly, for students that went back home to live with their parents, their use dramatically dropped. So I think we do have to be very careful with how we frame that. Thinking about the contributing factors, though, one thing that we do talk about from the student affairs side of the house and the health promotion side of the house is we essentially are going to have 2 freshman classes in the fall. Many of us are going back to in-person. So we have this traditional group of freshmen coming in to have that college experience. But now we also have this group that missed out on that first year that they're going to be making up for lost time. Adding on top of that, the increases in stress, anxiety, depression that we've seen, on top of that, just the normal high-risk behaviors we're going to see with fall being football season. So for all of us that are college football campuses, that's going to be an issue. And yes, Joan Masters just added some information in the chat. So Joan, thank you for that.
Oh, those are all really good points. Jessica, did you have anything to add to that? Okay, this is a good question from Amy. Thank you for this, both past and current work. Do you have a definition of what qualifies as high, moderate, and low effectiveness?
Yeah, I will say for the individual side that we base that on the proportion of studies that showed decreases in alcohol use or consequences, or in the case of college students who were not drinking or drinking at low rates, showed effects in slowing the progression to the initiation of drinking or to heavier drinking. So those, and it sounds like our slides will be made available, which is great. But you can also find that in the online and PDF version of the CollegeAIM, showing where those cutoffs were, but it's roughly 25, 50, and 75%, with higher effectiveness being 75% or more studies showing that decrease or prevention of initiation or increase in drinking. For the environmental side, I don't know exactly how they reached those. I know that it was relative to one another, but I wish one of their team members was here to be able to speak to that authoritatively.
I know that Fred just typed something in the chat box. So if you're also looking in the Q&A and chat, I think you'll see some responses to that. Mary asked if there has been any effectiveness measurement of student groups for students who identify as having a substance problem. Excuse me, not student groups, but support groups. Okay, let me ask the question again since I messed it up. Okay, has there been any effectiveness measurement of support groups for students who identify as having a substance problem?
I know that this is one of the areas that we're hungry for in terms of research. There are so many schools doing so much to support students in recovery, and even adding a question like, do you consider yourself to be in recovery from alcohol or other drugs, is shedding light on a sometimes hidden population on our campuses. I know that outside of the college student literature, there have been historically challenges of evaluating, for example, 12-step groups, especially if they're anonymous, because they work with anonymity, and to be able to follow people longitudinally involves them, in essence, being at a certain level of willingness to out their involvement in that. But I think that the need to be able to look at the impact of recovery programs on college campuses in a way that involves good outcome data. Folks are trying, I know that, and I think that's going to be the area that we see some really exciting growth in the future.
Okay, we're trying to get through these questions. We've got such a wonderful audience here. If you could wish for the moon, what kind of digital support do you need to support effective individual level strategies, such as apps, web-based platforms, digital coaching, etc.?
Yeah, I'll take a stab at answering this first, and then please, Jason, Alicia, jump in. You know, I'm definitely a part of a few different ongoing studies right now where we're using different technology. I think that we often assume that technology is going to, you know, maybe meet students where they're at better, like it's already integrated into Measure Life. It doesn't always work better. And in fact, sometimes in some studies has been shown to produce worse outcomes, like when we try to computerize motivational interviewing, for example. So I don't know that there's an easy answer to that, but I think we should continue to try to use that as, you know, a tool to implement the interventions and see how well it works. So right now I'm working on one study with Jason and other colleagues at the University of Washington on an app based intervention. And I think it's a case-by-case basis. What would you add to that, Jason and Alicia?
Honestly, if I could wish for the moon, I like that saying. I think that as the chair of the College Coalition in our state, what I hear from folks is it's not that they're looking for that next best digital or app-based thing to a school. What I've heard is the more they can get support from the administration for alcohol prevention, that's, if they could wish for something, that's what they want and need. You've seen that there are over 60 approaches to supporting students, and you've seen that those can come with a cost, but prevention is worth investing in. There's the old saying about an ounce of prevention. I would argue that it's never weighed more. And so if I could wish for something, it's making sure that that clear administrator support for and buying around the value of not just prevention. Alicia said it perfectly, effective prevention. And that's what we need.
Okay, I believe that we have our last question. I don't know when the last question came in. The question was deleted or what, but I don't see it anymore. I'm sorry. So I believe we made it through the questions. If anybody else has questions, if you remember Jason, Alicia, and Jessica's email, please email these questions to them. They'll be more than happy to answer them. We would like to thank everybody for being here today. Our time went by too fast. It was very informative, very helpful. We would like to thank once again our AAA and ITGA for the collaboration on this, and expect an email from me, and then the webinar will be up on our websites shortly.